Hello everybody, Suzanne Collins-Zink with Dawning Visions Hypnosis, here to ask you a serious question. One that I know that you know the answer to if you actually think less and just feel through it, through your heart and soul. And that is, do you enjoy providing therapy? Many people get involved in providing therapy. We're talking about mental health therapy in this situation because they believe they can help a lot of people. And then they get involved in actually providing the therapy, and they find that they're bored by it. They don't really enjoy their clients or patients. They don't really see a lot of changes happening quickly enough, so they don't find it fulfilling. Maybe they have bosses they do not like. Maybe their supervision that they're receiving sucks and is therefore unhelpful and maybe even detrimental. I certainly went through a few of those situations myself when I was working in conventional psychiatry as a non-licensed counselor. Those are a few reasons that come to mind. You know, providing therapy is not really meant for everybody. It takes a certain person to be able to do it. Number one, you have to have really strong boundaries. I don't mean being an asshole. I mean not taking on your patient's problems. They own their problems, and our job is to help them to let go of them by facilitating their treatment. Sometimes people are overwhelmed by the really sad stories that they hear, and this is really hard for the empaths out there because they just feel it so strongly. And as much as it can make a person be insightful in some ways, it can be really painful if a person is such an empath. This really isn't a great profession for those folks because they just get overwhelmed by the really sad stories and the traumas that their patients have lived through, or maybe are currently living through, which makes it even harder. Sometimes the stories that you hear are just really boring. I don't really have that problem with my particular clients because they come to me because they have real problems that no conventional therapist was ever able to help them overcome. But I do remember once sitting outside my ex-psychiatrist's door, listening. Well, I wasn't really listening. I didn't want to hear anything. I was actually reading a really funny article by Norman Lear in Saturday Evening Post or one of those magazines. And it just kept getting invaded because this person behind the door was complaining about stupid shit things that were happening in her job. I mean, things that anyone has to deal with who's ever had a job, okay? This is just called life. And my feeling was that if this was the type of client that I was going to be destined to work with, I didn't need to be working in the field because it really didn't merit my time or emotions. I wanted to work with people who had serious issues that they really needed to overcome and needed to have the expertise that I had to help them to do that. And I'm talking about people who have suffered real traumas. I mean, traumas that you would not want to live through yourself, those kind of traumas, causing a lot of mayhem in their life going forward for whatever the defense mechanisms built up for them to keep them safe, generally when they were younger. But it's all been outlived. So there's a lot of reasons why people may decide that they don't really like giving therapy. And I would suggest for you that maybe instead of doing therapy and mental health, you might want to do something like become a life coach and just help people to better understand how they can achieve the goals that they want to achieve through better understanding their values, their beliefs, and really what they enjoy doing in life. Coaching pays really well. It's like, I don't know, $400 or $500 for 45-minute sessions, and generally they're sold in packages of 8, 10, 12, something like that. So you can make significant money doing that. Or if you've worked in corporate America for any period of time, you can become an executive coach, and they make even more money because they're helping executives to better their interactions with their employees and with their bosses and whomever else they have to interact with. You can make really good money working with those folks. Maybe, I don't know, $800,000 an hour. Some people making even more. So those are my suggestions for you on if you really do not like doing therapy with mental health patients, but like the idea of helping people. And it's a pretty easy pivot to make, and you can do it through your phone or over video calls. And again, they're like 45-minute sessions. You can't lose if this is something that sounds viable to you. You'll have to find your own people, and that takes a little bit of work to figure out. But if there's a will, you can find a way to make that happen for yourself. Because people who are professional are always looking for help to become better at what they're doing. It is the nature of the professional. And coaching is a really big business because of that. So that's my idea for you for today. If you do like doing therapy and you just need to learn how to have better boundaries and to have better tools and techniques to actually help your clients heal instead of managing symptoms and having them over-medicated, which is basically what the psychiatric world does to the patients, unfortunately, I do offer a 2-day VIP program to help you integrate hypnotism and NLP into your practice, or you can just become a hypnotist and NLP practitioner, as I am, and I can help you to learn how to do these skills proficiently. There's a 12-month mentorship that I include in it. I only take on one trainee a week, so it is pretty, well, shall we say, limited, because I have to obviously mentor all the people who I take on. And there needs to be time to do that in real time so they can help their patients to heal as they're learning how to do this work proficiently. And I'll leave information, well, my contact information in the description below if you're interested in doing that. I have actually retrained a few people who went through NLP and hypnosis trainings who are not getting the results that they wanted. And they're now doing really, really well. So there you go. Better to get trained by someone who can actually train you how to do this stuff really quickly, mentor you so that you can actually help people instead of getting minimal results or even harming them because you didn't know what you didn't know. That does happen, regardless of what some of the people in the hypnosis business would like you to believe. And I guess that's it for today. Thank you very much for spending your time with me. Till next time. Bye-bye, all.